Larry Callaways is a doctor in chiropractic medicine. He comes from the Northgate program and has gone on to get certified as an athletic trainer up at Whitworth, up in Washington. And again, like a lot of speakers, it is a story that I really want you to pay attention to. He's going to talk to you about chiropractic medicine and all he's done. But his story of going up north, becoming an athletic trainer, battling up there, becoming a certified strength and conditioning specialist, being an athletic trainer up there in a clinic, coming back down here, trying to work at various health clubs, getting shut down by a few because he has too many credentials, and then putting his way through school to become a doctor, and now practice on his own, trying to create a new office space out here in Walnut Creek. It really tells of his hard work and intensity and his passion, and this is why he is successful. So without further ado, Dr. Callaway.
Well, that's it. That was my speech. You just did it all for me. So I've done this 3 times now. Some of you, like Glenn said, I was 10 years ago, 11 years ago now. I was in your seats taking this class. Some of the professions I listened to, some of them went in one year and out the other, so you don't listen to me, at least get the points on the test that I'm going to get you. Who knows what a chiropractor is? We'll start with that. Other than you cheat, you work for a chiropractor.
Back and neck solutions.
Okay. Back and neck specialist?
Yeah.
Anyone else? Has anyone been to a chiropractor? What did they do to you?
Crack my back.
Cracked your back?
And then kind of like squeezes out my
Okay. Now you're.
The chiropractor I work for, they do more than just crack backs. They align, they do postural assessments. I don't know what you do, but they did a lot of, they would get you massaged before you were adjusted, and then a lot of corrective exercises, so those adjustments last longer. But they would do, you can adjust a wrist, a finger, an elbow, a knee, an ankle, a hip, more than just the spine and neck.
Correct. So most people, which chiropractors have kind of pigeoned themselves into because of the way they've marketed throughout the years, we do car accidents, neck ache, backache, whiplash. That's kind of what we're known for. But here's the answer to the test question. The chiropractic profession is actually, chiropractors are doctors of the nervous system. Did you get that? Doctors of the nervous system. I think it's like 34, 35. No, I'm just kidding. So the premise of chiropractic started 10,000 years ago, but it didn't really get its name until most recently, quote unquote recently, 1895. A guy pushed on some other dude's neck, made it pop, and he got his hearing back. And what the heck does pushing on someone's neck have to do with hearing? It's because the relationship of the nervous system to the different components of the way that the nerve system flows through the spine. So that's kind of where chiropractic came from. So there's one answer. So all those letters behind my last name is kind of where Glenn was starting my story. Is I went up to Whitworth after Northgate, which is a small little school in Washington that when I was graduating, you had to go to you could either go through the intern route, which doesn't exist anymore, or you could go through the accredited route. And thinking I was on top of my game, I went to one of the only accredited schools on the West Coast. Now, if you've never been to Spokane, Washington, it's cold. It's not Walnut Creek. It was an experience. I hated my first year in college, but the rest of the time I came back and I fell in love with sports medicine. I fell in love with working with athletes, so much so that I continued on my path. I got the athletic training certification. I went and got my CSCS, and right away I worked at a PT, physical therapy place, and got put in charge of 5 high schools. I would bounce around 5 different high schools in the afternoon, starting at 2:30 and getting home about at 9 o'clock. So some of you that have worked at Northgate, you know basketball goes till 11 o'clock sometimes, 10 o'clock, depending upon when Mitchell or Bucklew is done with their practices. So those were my days all the time at 21 years old. And I come from a nice family, I think, and I wanted to have a family someday. And Glenn always said, if you want to have a family, don't be an athletic trainer. Okay, Glenn, but I love it. And I was seeing that at age 21, that I would go to work at 7 in the morning to do the physical therapy stuff and then do what I love, the athletic training, and I'd be home at 10 o'clock at night, which is okay when you're 21 and single and don't really have any responsibilities other than to show up and go home, show up and go home. So my chiropractor's like, why don't you go to chiropractic school and see what it's all about? I said, okay, it's another 3 years. I'll be 24, 25 when I'm out. If I don't like it, at least I'm a chiropractor now and I can own my own clinic and do athletic training on the side or something of that nature was my thinking. Little did I know that chiropractic wasn't just twisting neck and popping back, because that was my experience in chiropractic. I pretended to be a break dancer for a little while. I played football, I played basketball, so my body was wrecked. So I'd like to go get popped every once in a while and it would feel good. And our joke now, my joke now, is that chiropractors, I got addicted to crack, which is true, because what happens when your bones pop is you release endorphins. And those of you that took some sort of physiology at some point, endorphins make you feel good, like the runner's high, same kind of concept. So that's what I thought chiropractic was. And then day one, I found out that chiropractic was being a doctor of the nervous system, and the story I started with. So during my school, I said, okay, I'm twisting and popping necks. What is really happening above and beyond? Why do I call myself a doctor of the nervous system when I tell you it's about the nervous system, but then I go over here and tell someone else they have a short left leg, and someone over here, your shoulders? What am I telling people? I wanted to get my story straight, so I decided to become an extra nerd, and I went and became a board-eligible neurologist. And so I understand when I twist and pop someone's neck, that's not what I do to this day, but when I do that, I know what's happening all the way from their toes all the way back up to their brain. So sometimes if someone has a pupil a little bit bigger on one side of their body, I can make a correction and get their eyes to make themselves balance. And who would have thought that chiropractic would ever look at pupils? That's kind of weird. So that's all the names of, the really long one. Certified Golf Fitness Instructor, Medical Practitioner Level 2. Yeah, that's what I say too. So basically that one was Titleist Performance Institute puts on this class. I was working with a couple golf instructors in the area, marketing with them, so I went and took a couple classes. It helped that one was in Las Vegas. So I swear I went to the entire class, sat in my chair the whole time. Yeah. And so all that is kind of the letters behind my last name, how I got to where I did. With that, medical practitioner too, the type of chiropractic that I do, which I'll talk about in a moment, I proved that what I do alone improves balance in golfers. And I was able to go and speak last October in Florida with that. Again, I was in class the entire time. Not really. Florida's a nice place if you haven't been there. So that's kind of the boring stuff about me and the letters behind my last name and all that stuff.